Hi guys, today we're going to be talking about public health. So that entails social inequalities, health belief models, um, and decision making and the psychology behind some of the decision making. So we'll start off by talking about public health as a science. And yes, I said as a science. So it's the art of preventing disease, increasing longevity, and promoting health to increase the quality of life by dealing with dangers affecting the population, whether that's large or small, if it affects the entire population or a large amount of the population, it is a factor or a problem that is dealt with by the public health organization of that population. So they also detect and prevent against disease, whether that's physical or mental. They promote health behaviors, they track cases, they look at health indicators. And when I say health indicators, I mean things like washing your hands, breastfeeding, vaccination, uh, suicide prevention, and even condom distribution. It's a wide array of things. Alright, so next we'll talk about the social determinants of health. So we'll start with your childhood experiences. So when you're young, you generally eat what your parents give you. So they could be unknowingly giving you the wrong foods. Um, they could be creating unhealthy behaviors in terms of, I don't know, every time you cry or you get upset when you're young, your nan buys you an ice cream. So then when you have a bad day at work when you're an adult or something happens, you buy yourself a tub of ice cream. It's not a healthy behavior. um, that actually leads into social support a bit as well. So, which is the next one. So, the people around you, your friends and family, do they support healthy behaviors? Things like that. Your housing, do you have a place to live? Do you have warmth in terms of heating? Is there mold and wet growing everywhere? You're going to get sick. Is it clean? Things like that. Your access to education in terms of from a young age to going to work, to university, even. Um, just either to further your knowledge of health or just to better yourself so that you become a productive member of society. Your family income. I understand some people think that it's quite expensive to eat whole foods and healthy things, for example. But when you think about it, yeah, you can get a meal for £5 at McDonald's, or you can go somewhere like Tesco or something, and you can spend £5 to £10, and you can get meals for like a week. So yeah, it seems expensive, but when you actually think about it, it's not. Um, our communities, is the community you live in safe? For example, like we have a problem with knife crime in London. Uh, when I talk about health and public health, it could literally be that. Like, are you going to walk out of your house and someone's going to come out with a knife at you? It's important. It's a big factor in terms of like how long you've got to live. And then your access to healthcare or like health services. We're lucky here. We have the NHS. Um, it's brilliant. I don't know. People are probably going to have a go at me for saying that, but it's absolutely brilliant. You cut your finger, something happens to you, get on the phone, ambulance, job done. It's not like we're in the States. You get a bill at the end of it, pay it in your taxes, job done. Um, Employment. Can you create money? Can you create wealth? Can you afford to get yourself a house? Can you afford to heat your house? Can you afford to buy toiletries so you can keep yourself clean? Things like that, guys. Those are like the social determinants of health. Alright, now with all that in mind, what are the responsibilities of any public health organisation? Obviously, the first thing is to make any population healthier or as healthy as they can be. Next is to stop or to lessen the differences between groups. So, whether that's a social economic difference, so whether you're rich or poor, your ethnicity, so whether you're black, you're white, you're Chinese, you can be purple for all I care. You deserve and you have the right to be as healthy as anybody else. And when I talk about health, I talk about the complete state of mental, physical, and social well being, not merely the absence of disease. So, how do they go about doing this? They promote healthy lifestyles, they advise governments, and they also support local governments. What else do they do? So, they protect against public health hazards or emergencies. So, some places in the world, there could be an earthquake, They help with that. They might even do some preventive measures before it to try and reduce the impact of it. Um, they again, that leads into the next one. They prepare for issues before they arise if they can. How do they do that? Sometimes they offer social care, immunization, so they'll vaccinate people, or screening programs. Another thing they try and do is to create a health system. We're lucky here, we have the NHS. Some places in the world they don't really have a proper one yet, or if there is one already established, to just make it better, and to allow for a specialist workforce. There's no good needing a heart surgery and there's no heart surgeon about. So to allow for people to be educated in fields to better society. So you could be an engineer working in waste management. Getting rid of waste correctly allows us to not have to deal with cholera on a daily basis in countries like the UK, or not countries, places like the UK. So how do they do this? They research, they collect data, then they analyze that data, and they act accordingly. All right. So next we're going to go on to policy making, um, and fear appeals. So policy making, it needs to be clear, concise, and simple, really. So without being a specialist in the field, you can understand and follow any instructions that you're given. Not everyone's a specialist in a biological field, and obviously everyone has their role, but so it's clear for everyone to understand. So you know what you should be doing. They will identify the problem, how the problem is going to be solved, what you should be doing, if anything, if they're not going to do it for you, basically. Um, and then you should have a way of guiding you to make better decisions, like a set of principles, maybe. Typically, these things are supported by legislation. Um, a good example of that are things like food safety. If you work in a restaurant, I've had a couple waiter jobs. If you work in a restaurant, there's certain things that you can't do, like literally health and safety. You're not allowed to do them. Things like that, and they are important. Like washing your hands. If you have an issue where you've been throwing up or you have diarrhea, you shouldn't be serving food to people. Things like that. They're in the legislation. They're there for a reason. Next, we're going to fear appeals. So talk about perceived threat and self-efficacy. So perceived threat is this really a danger to me? And then efficacy is, well, if it is a danger to me, can I actually solve that problem anyway? So let's use smoking example. So let's say you smoke. The perceived threat of smoking. Okay, so you know that there's a link between smoking and cancer, but you also know Jimmy down the road who's 90 something, he smoked his entire life and he's completely fine. Do you perceive yourself to be like Jimmy and you're going to be fine at that age? Or are you going to perceive that as an actual threat? And then efficacy is how obtainable is that goal. So again, if you're smoking, if you can stop smoking. So for example, I know the NHS offers patches for people that are trying to stop smoking. Obviously that takes a strain for NHS. I'm sure will help with funding long term. And obviously preventing things is always better than a cure. Alright, so instead of waiting till you have a hole in your throat and you have to talk out of your throat, let's stop you smoking now when you're 20 and you can still do everything you want to do, etc. Or you can go through the heartache of that later on and have those issues. So fear appeals is generally used on things where the goal has to be, it's perceived, efficacy is perceived as quite difficult, I would say, and then the fear is a thing that will light the fire under the person's belly. So in the UK, over all the smoking packets now, there's gruesome pictures, and that's meant to put people off smoking. It's a fear appeal. You look at it and you go, ugh, oh, that's what's going to happen to me if I do that. And hopefully you put down the packet and get on with your day. Alright, so this leads on quite nicely to message framing. So in terms of message framing, there's two types. There's a positive and there's a negative. With any health relevant communication, it has to be, you can split it into a gain and a loss. So negative framing is obviously loss, and positive framing is a gain. The way in which you word it seems to have a direct correlation to the outcome and how the behavior is acted upon. Um, with that said, let me give you an example. So, positive framed message would be using condoms can keep you healthy. Negative framed message would be if you don't use condoms, there's a chance you could get an STD. A really interesting way to describe this to someone is there was a study done in 1981, I believe it was 1981, yeah, um, and they came up with a scenario where there's a population of 600 and there's an outbreak of a deadly disease. So how would you deal with this? And they offered 4 solutions and they asked the participants to pick one. So program A, if it was adopted, 200 people would die. Program B, if it was adopted, there was a third probability that 600 people would be saved and 2/3 probability that no one would be saved. If program C was adopted, 400 people would die. If program D is adopted, there's a third probability that nobody will die and 2/3 probability that 600 people would die. So which one would you pick? With that said, obviously when you look at the numbers are exactly the same, which is why it's all up there and it's all in the wording of the message. And these were the results. So in the positive framed version, the majority of the respondents preferred saving the 200 lives for sure at 72%, and the over the option that offered a 1/3 chance of saving the 600 lives at a respondent rate of 28%. Whereas in the negatively framed version, however, most people preferred the 1/3 chance of losing no lives at 78% to the sure loss of the 200 lives at 22%. So in simple terms, the general tendency of risk aversion for positive frames and risk seeking for negative frames. So with that said, as I mentioned before, the numbers are exactly the same. The only thing that changes is the way in which the message is worded, and you can see that it's completely changed the outcome. The numbers are the same, the disease is the same, the population is the same. It's crazy. And whenever you're doing anything to public health in terms of communication to your population, public health announcements, talking to governments, whatever it might be, the way in which you word the message has to be looked into, and there is a lot of psychology involved in it, and that's why it often determines the outcome. Even in situations where you believe there's a choice, there is a choice, but also it can be manipulated by the way in which it's worded and communicated to you to get a certain outcome. Okay, so next we're going to go on to belief models. So we'll we'll start with the 6 constructs. So perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to action, and self-efficacy. So perceived susceptibility, definition, one's opinion of the chances of getting the condition. In terms of application, so you would define the population at risk, the risk levels, and then the personalized risk depending on the person's features or behavior. So next we go on to perceived severity, so one's opinion of how serious the condition is and the consequences of it are. In terms of application, specify the consequences of the risk and the condition. Next, perceived barriers. So this is one's belief in the efficacy of the advised action to reduce the risk or the severity, or let me not use that word again, the seriousness of the impact. Application, so define action to take, how, where, when, and the positive effects to be expected. Next, on to perceived barriers, one's opinion of the tangible and psychological costs of the advised action. Application, identify and reduce barriers through reassurance, incentives, and assistance. Next, we'll go cues to action, strategies to activate readiness. Application, provide how-to information, promote awareness and reminders. And lastly, the self-efficacy, the confidence in one's ability to take action. Provide training, guidance, and just anything they'll need to perform the action. So I guess if we were to think about that in terms of, I don't know, like condoms and STDs, for example, we can use that example. It's just an easy one to use. So, for example, a perceived barrier for that could be someone might get embarrassed about talking to their partner about condoms, or some guys complain that the feeling they get while using a condom isn't as good, and then that has an impact on why they don't use them, for example. So an initiative could be getting young people talking about condoms, making it a more comfortable topic. Little tricks of the trade, like putting a little bit of lubricant inside the condom, increases sensitivity. Yeah, just things like that. These models have been around, I think, since like the 1950s, and they are used to determine people's like decision making, or how they will perceive the message that is being given.